This is St. John's Community Clinic. The doors haven't even opened yet. Already, you can see dozens of people waiting to get in. We're about to show you how federal stimulus dollars will help community clinics like this serve a lot more people, while at the same time attract world-class physicians to work here. Dr. Rishi Manchanda sees patients who are usually turned away. They are uninsured, among some of the poorest in South Los Angeles. It's not easy to recruit doctors to work in community clinics like this. They work long hours and they see lots of patients, sometimes upwards of 25 a day. And they can make less money, up to 40% less than doctors in private practice. Dr. Manchanda could have gone to work anywhere else. He's a graduate of prestigious Tufts University. Life is a lot more challenging, it sounds like. Why would you do this?
I told myself that I would only go into medicine if and pursue my life's dream if I knew that it wouldn't break the bank for my parents, that it wouldn't rob their retirement money, and that it could also do something that was needed.
Rishi Manchanda, the son of Indian immigrants, knew he wanted to become a doctor, but his family didn't have the money to pay for medical school.
So when was the last time we did a physical?
So he signed a contract with the National Health Service Corps.
Breathe normal now, okay.
For every year the government paid for his education, Manchanda is required to give a year back, working at an approved clinic like St. John's. Where would these people go if they couldn't come to see you?
The emergency room.
The National Health Service Corps was awarded $300 million in stimulus money to help more than 3,400 physicians and healthcare professionals pay for their education. The fact that they have to give back to clinics like this makes recruitment of top-notch people a whole lot easier.
It makes it more than easier, it makes it possible. It's almost impossible to find doctors.
Any concerns about his speech?
Dr. Vanessa Neal is one of those doctors. She's a graduate of Johns Hopkins Medical School in Baltimore. She says the program allowed her to start her career debt-free. A lot of your colleagues who graduate from medical school, I assume, are starting their careers $200,000 in debt. Was that a concern of yours?
Oh, definitely. I was really concerned about taking on that burden to myself as well as my parents.
Now she's free to work with the patients she feels need her most.
So you're not insured. If you could not come to this clinic and see Dr. Neal, where would you go?
I don't know. It's very difficult.
Are you 3, 4?
Doctors Neal and Manchanda say even after they fulfill their contracts with the government, they will stay on.
Thanks, Neal.
Half of everyone who goes through the program does. Thelma Gutierrez, CNN, Los Angeles.
Marta? Hola, ¿cómo estás?